government agencies that regulate the practice of medicine or the provision of healthcare services, and then the public generally they have interest in healthcare services. So healthcare can be looked at in a number of dimensions, looking at first the clinical efficiency or effectiveness, and then patient safety, timeliness of care, patient-centeredness, equity, efficiency, and then patient experience, and then continuity of care. So we're going to look at each of these and understand what they actually mean. First, clinical effectiveness refers to the ability of the interventions or the treatments that are offered in a health facility to achieve the desired outcomes. So if a patient goes to a health facility, the patient expects that their well-being will be improved. So whatever is actually performed at the health facility, it is everyone's desire that the optimal outcomes are experienced. So a number of tools can be used to achieve this. Of course, you need to have competent health professionals who will use the most latest evidence to handle patients. So this evidence can come from the clinical protocols and guidelines in order to treat patients. And then patient safety. This is actually also related to the do no harm principle in ethics. When patients come to the health facility, they expect to actually improve. So you, as the healthcare provider, should actually make sure that the patient does not get additional harm within the health facility. So the harms can come from medical errors or from infections that they obtain or that they get from the health facility, the ones we call nosocomial infections. Or as they are moving, they could fall down and then they get perhaps a fracture. So you don't want these things to really happen within the health facility. So you don't want the patient to be electrocuted because they are open wires within the hospital facility. You want to make sure that the patient is not harmed in any way. The third dimension is what we call timeliness of care, that the services should be provided promptly without any unnecessary delays. Unnecessary delays happen at different levels, either the waiting time for consultation or the waiting time during the time for taking diagnostic tests, and also time that is lost in them receiving medications or treatments that have been prescribed for them. So time is actually very important. You don't want patients to keep waiting forever. And then patient-centeredness is a dimension that concerns with recognizing that patients are actually very important in their own care. They should be involved through open communication, such that they can participate in decision making in the nature of treatment and care that they receive. Efficiency is the dimension that focuses on using resources to deliver high quality care. You don't want to misuse resources within a healthcare industry, well knowing that this actually We have scarcity of resources. Resources can be lost through not following the appropriate principles of practice, clinical guidelines, and protocols. For example, if a given procedure is not done well, then it means that the person is going to use more and more resources in terms of the syringes, in terms of medicines, in terms of things getting spilled on ground and getting spoiled, things getting expired, medications getting expired in the medical store. All of things means that these things actually bring about inefficient use of resources, and definitely this will increase healthcare costs. That is not something that any entity could be or could actually want to experience. The other dimension is equity, which is that all individuals should be treated fairly. This is to say that everyone should have an equal opportunity to access high quality healthcare regardless of their background, socioeconomic status, race, or ethnicity. So fairness is actually very important in delivery of quality healthcare. As the patient is receiving care, they should they should be treated with respect and dignity, and that they actually find comfort during the whole experience of receiving care. You don't want to provide care that is littered with disrespect, lack of open communication, and also making decisions on behalf of the patient without involving the patient themselves. So if, for example, the patient comes for to deliver, okay, and then the midwife is shouting, abusing, is insulting the woman in forms that are not appropriate and professional, the patient will not have a good experience delivering. So we need to have what we call positive patient experience during care. The other concept is related to continuity of care, that if I come to a health facility, it is very important that care is actually coordinated, that I can move from one health provider to the other, and the care is actually coordinated such that the information about me is seamlessly shared between the health providers who are handling my case. So you don't want to find difficulties moving from one provider or one health facility to the other because of the difficulty in translating what you have received in one facility and what the other facility health providers are actually telling you. So you need to have a seamless transition from one department to the other, or from one health facility to the other, or from one health provider to the other. The last dimension relates to the financial implications associated with quality in healthcare. Whereas quality is very important, we should not misuse our resources in delivering healthcare. The resources should actually be used in a way that maximum benefits are actually derived from the resources that we have. So there should be value for money. So quality in healthcare therefore means, if you look at all the dimensions, means that we are going to look at patient safety. We need to prevent any harms or injuries, and we should also bring about better patient health outcomes, and then the patients will be satisfied with our services, and that we shall also use our financial resources effectively. So we can look at quality in healthcare in 4 dimensions: structure quality, process quality, outcome quality, and patient experience quality. When we talk about structural quality, we refer to the physical infrastructure of the healthcare system and how it affects the quality of care that we provide. The health facility has to look at how accessible it is in aspects of its location, and also whether it is working 24/7 in case of emergencies, and also if I want to meet a specialist, how easily can I meet this specialist? How easily can I make an appointment with a specialist? All these are aspects to do with the accessibility, and they fall under structural quality. And then physical facilities. Okay, when the patient is within the health facility, how clean is the ward? How easy is it for them to move around? How easy is it to access the reception and the different sections of the hospital, the lab, the consultation room? What type of equipment are you actually using? And then also the level of staffing. These are all structural matters that relate to quality. And then technical quality relates to having qualified health professionals to deliver evidence-based care that is based on the latest guidelines, appropriate technologies to make the necessary diagnosis and treatments. So that is technical quality. Functional quality relates to the ability to meet the patient's functional needs and requirements. This relates to accessibility and availability of services, convenience and responsiveness to patient preferences. The process quality looks at how procedures, processes, or workflows are happening within a healthcare organization. So this looks at efficiency, effectiveness, and safety of care delivery processes. How can patients, or when patients reach the health facility, how are they handled? Where is the reception? How easily can they meet the health professional, that is the consultation, and then the processes that are followed in requesting for lab tests or radiological tests, and then the communication amongst the health providers and the patients, and then implementation of protocols and procedures. These are all related to process quality. And then outcome quality focuses on the results and the impact of healthcare intervention on patient outcomes. When the patients come, we expect them to go back home when they have what you can call optimal health, when they have improved. So you don't expect patients to be dying frequently within the health facility. So we look at issues like mortality rates, how many patients are dying, and then we look at patients who come and then get complications within the facility, and then if they came walking, are they able to go back walking? Or if they came limping, are they going to go back when they can walk steadily? What are the patients reporting in terms of outcomes? Is there any improvement? Okay, so we want patients to go back when there is change in terms of health outcomes. Okay, so thank you very much for listening to this presentation.